Welcome to Focus on Health, a show on all matters health, wellness, and lifestyle. I am your host, Joy Bofenda, and on this episode, we discuss abortion alongside Professor Anthony Wanyoro of the Kenyatta University Wellness Center. But before we dive in, take a look at the health updates. So, Daktari, kindly introduce yourself to our audience.
So my name is Professor Anthony Wanyoro, an obstetrician gynecologist and an associate professor of obstetrics and gynecology at Kenyatta University.
Okay, so the topic of the day is abortion. What is abortion?
Well, abortion has made a definition depending on the region that you are coming from, but medically, abortion is any termination of pregnancy before it is viable. So looking at viability, different countries or different regions have different ages of viability. Like in our region, we talk about viability after 28 weeks. So any termination or any loss of pregnancy before 28 weeks in our region can be termed as an abortion, whereas WHO looks at the whole world and it looks at termination as pregnancies that are lost below 22 to 24 weeks.
So, and what are the types of abortions? We hear terms such as threatened abortion, complete abortion, clandestine. Could you elaborate on that?
Well, you may have broadly two types of abortion. So the main broad classification is a spontaneous abortion, which is basically known as miscarriage, or an abortion that is not does not occur, so it is induced abortion, which can be induced clandestinely or it could be medically indicated. So when you look at spontaneous abortion, it has different classifications. So it starts with threatened abortion, where a mother starts to have a bit of bleeding, but there are no contractions, or the uterus is not contracting and the cervix is not open. So this may progress into an inevitable abortion, where you find contractions will start and the pain will start, bleeding will also increase, and the patient may start to bleed in clots. However, the hallmark of inevitable abortion is that the cervix will start to open up. Then the next step after this is that the patient may have complete expulsion of all the product of conception and it becomes a complete abortion, or the patient may have incomplete expulsion of the products of conception and the abortion now becomes an incomplete abortion. This incomplete abortion may go further to become septic abortion if it is not taken care of. So that is another class of abortion which is dangerous to the mother.
So most people term abortion as a bad thing, but you've mentioned that in some instances abortion may be medically indicated. What are these instances?
Well, the instances could be either because of maternal indications or because of fetal indications. So for maternal indications, of course, when you look at the life of the mother, if the mother's life is at risk, then there is an indication of a termination of that pregnancy to try and save the mother. Of course, for the fetus, you look at severe congenital abnormalities that may not be compatible with life after birth, and this you may be allowed to legally terminate that pregnancy. Of course, there are many women who may also, because of their social circumstances or other circumstances, decide on their own volition to have a termination of a pregnancy, which is not basically a medical indication of the termination of the pregnancy.
Would you term as termination of an ectopic pregnancy as abortion?
Well, an ectopic pregnancy is a different thing altogether, because this is a pregnancy that however long it takes, it cannot become a viable pregnancy, and it poses a major threat to the life of the mother. And the pregnancy, when we talk about an ectopic pregnancy, the pregnancy is actually outside the uterus, and most of it is within the fallopian tubes. So given enough time, between 6 to 10 weeks after the pregnancy starts as an ectopic, it ruptures, and this becomes very dangerous for the mother because she starts to bleed internally and it can kill her. So that is, it must be terminated, or an operation is usually done.
So thank you, Dr. for that clarification. So let's move forward to spontaneous abortions. What are the causes of these ones?
Spontaneous abortion can be looked at depending on the different ages of the pregnancy. But when you look at spontaneous abortion, you can look at maternal and fetal causes of spontaneous abortion. So when you look at first trimester abortions or miscarriages, because we are talking about spontaneous abortions, then you look at mainly abnormalities within the zygote itself, mainly chromosomal abnormalities. So when life does not start and you get an embryonic gestation, then eventually it will terminate itself. Of course, we also have another major group where you find there is a normal pregnancy, but within the first 14 to 16 weeks, there is inadequate production of the hormone that supports the pregnancy, because by this time you find that the placenta has not fully developed. So you find that the support or the progesterone is being produced by another organ within the ovary called a corpus luteum. So there are some women where you find there is insufficiency of that corpus luteum, and they may also get a miscarriage before 16 weeks. Of course, in the maternal side, we also know that there are causes that may lead to a miscarriage, but these are usually things like infections, like when you look at infections like rubella, viral infection mainly, rubella, cytomegalovirus, some protozoan infection like toxoplasmosis may also cause a miscarriage for the mother. Of course, we also have structural problems within the cervix, where you find that when the cervix is incompetent or is not able to hold the pregnancy as it grows, then you might find that subsequent mothers may lose the pregnancy with a descending gestational age, and sometimes they may also lose a pregnancy in the second trimester or late first trimester because of a structural problem within the cervix.
Yeah. So you also mentioned an embryonic. Is this the same as a blighted ovum?
Yes, of course the general term is a blighted ovum, but the medical term is an embryonic gestation, because the embryo does not develop within a fertilized egg.
And does it resolve on its own, or does it need medical techniques to get rid of it?
Well, when you have an abortion or you have a reason to terminate a pregnancy. There are different ways to terminate a pregnancy depending on the gestational age of that pregnancy, and also whether there is a fetus that has developed, and of course the mother's choice and your ability to follow the mother. So for pregnancies, most of the pregnancies you can use either surgical aspiration or surgical termination of a pregnancy, or you can use medical termination, or sometimes you can watch and wait to see whether the pregnancy will terminate itself. So for blighted ovums, you can either use, you can wait, and you find that in most of the times, within 4 weeks after diagnosing an early pregnancy demise, then the pregnancy may terminate itself. But this, you need to follow the mother closely. Of course, you can also use medical termination of the blighted ovum, or you can also use surgical termination.
And so during pregnancy, there is usually implantation bleeding. Can you differentiate it from now a person having an abortion or a spontaneous abortion?
Well, implantation bleeding, it's not a very common phenomenon. Because of course many people think that when a pregnancy is implanting, that it's like the way you would plant a seed. Okay, so it is very rare for women to bleed during implantation. But for those few women who have implantation bleeding, usually you find it is very mild spotting, and of course there is no pain, and it will occur very early, maybe about the 6th to latest 7th day after fertilization. So in most of the times at this time, women are not even aware that they are pregnant. Yes.
So, and can spontaneous abortion be prevented?
Well, depending on the cause, because if it is because of things like luteum defects, then you can support the pregnancy with a progesterone, and we'll find that the threatened miscarriage will stop threatening, and then the patient will continue to full-term pregnancy. If it is because of maternal conditions, and you control the condition, then you find that the mother is able to continue with the pregnancy. So as long as the pregnancy is normal and you have managed to be able to diagnose probably what is causing these recurrent miscarriages in a mother, then you can put up measures to reduce the risks of that pregnancy coming out.
We're taking a short commercial break, but do stay with us and interact with our social media platforms. That is KUTV Kenya on X and YouTube. You can also find me at Dr. Joy Bofenda across all social media platforms. We'll be right back, but first, the Did You Know segment. Welcome back to Focus on Health. We are continuing the conversation on abortion alongside Professor Anthony Wanyoro. Take a look. Okay, so Dr. as we conclude on spontaneous abortion, what is antiphospholipid syndrome? We hear it a lot on social media.
Well, that's a big word, but antiphospholipid syndrome is just a condition where you have an autoimmune disease, which leads to several conditions in an individual, So people with antiphospholipid syndrome may have problems with thrombosis, so they may have thrombocytopenia. They may also have thrombotic episodes. In women who are pregnant, sometimes they may have recurrent early pregnancy losses, or they may also have pregnancies where they have fetal demise within early second trimester. In some women, of course, when they are pregnant, they may also have conditions where they have fetuses that have intrauterine growth restriction. And also these women, they may also have very severe hypertension in pregnancy when they have the antiphospholipid syndromes.
So how do you mitigate the psychological effects of miscarriages in women?
Well, the first thing is, of course, the main thing is basically to counseling. If it is a spontaneous miscarriage, remember, this is a woman or a couple that has invested a lot in that pregnancy. So and of course there is some unfulfilled need when they lose that pregnancy. So if proper counseling is not done in these patients, and then it may have some psychological effect. But counseling these patients, knowing what has caused this miscarriage, and ensuring that you mitigate against future miscarriages in such a patient may help a couple like this. Because there are also the couples that or women who terminate the pregnancy. And by the way, termination of pregnancy in this country is guided by Article 26(4) of our 2010 Constitution, which basically says that abortion, that is now termination of pregnancy, is basically not allowed in this country, and it is illegal. But it goes on to put some conditions where you can legally terminate a pregnancy. And this we look at where it says where a health care professional, and there are different health care professionals, if they may decide that the life of the mother is at risk, or there is any other law that allows you to terminate the pregnancy, then that gives us more window where termination can be allowed.
And do you think this law is really helping Kenyans, considering illegal abortion is still continuing?
Well, of course, we know that even where pregnancy termination or abortions are allowed in the world, we still have people who terminate pregnancies illegally. So making termination legal or abortion legal may mitigate some issues, but also may not mitigate some other issues, because you find people still go to backstreet areas where terminations are done, and then of course they may end up with severe complications related to abortions.
With your experience, are the effects of abortion very common?
Well, it depends on, of course, if you look at the safety of a termination of pregnancy, and looking at the safety, like any procedure in medicine, you look at the person who is conducting the abortion. Is that person safe? Is he well trained in conducting a pregnancy termination? Then you also look at the safety related to how the procedure is conducted. Is it conducted with the right equipment? And then, is that termination conducted in an environment that is safe, of danger to the woman danger to to the person who is doing the procedure, and also in a situation where there is a reduction in the risk of infections. So when you look at all this and you tick that everything is correct, then an abortion becomes very safe. And this is the whole hallmark of safe abortion practices.
And would you term as medical procedures leading to abortion more safe compared to surgical ones?
Well, both have complications and both are safe and both can have complications. So when you look at medical or therapeutic when you use medicine to terminate a pregnancy, you find that the main complication are related to the use of medications, which are usually two types of medication. You can use mifepristone and then later use misoprostol. So the main risk is, of course, you may have an incomplete abortion, and two, patient may also complain of pain, and the third thing is that you may also have excessive bleeding. Of course, when you are doing a surgical evacuation, which is either dilatation and aspiration, using whichever method, it could be electrical, it could be manual, then of course you may also have excessive bleeding, because you can also introduce an infection, or you can also perforate the uterus, and of course, if you don't realize you have perforated the uterus, and we have seen this in many patients, you may end up also removing some pieces of gut as you do the procedure, and the patient in most of the times will be very sick, and oftentimes they may also die.
In other cases, we usually see a woman after undergoing an abortion tends to have subsequent abortions thereafter. Is there a reason for this, especially considering the rhesus factor or the blood groups?
Really, the main thing is that one, if an abortion is safe for whatever reason, then it does not lead to subsequent abortions. So that is one of the myths. What may lead to subsequent abortion is the process of conducting a termination of a pregnancy. So if there is injury to the cervix and you reduce the integrity of that cervix, so the cervix becomes incompetent, then this may lead to subsequent pregnancy losses. But it's not the termination itself per se, it is actually as a complication of your procedure if the procedure is not done correctly.
Okay, and what about individuals who are negative in their blood groups?
Well, for individuals that are rhesus negative, if a woman is carrying a pregnancy and she has something like a blighted ovum, of course, when you look at rhesus incompatibility, the main problem is when there is fetal blood going to the maternal side. If this fetal blood is rhesus positive and the mother's blood is rhesus negative, then the mother will start to form antibodies against rhesus positive blood. So it only becomes dangerous if the fetus has reached a point where they have started to form red blood cells. For something like a blighted ovum, there are no red cells, so you don't need to do anything. If you give medical termination of pregnancy within the first trimester, of course, the risk of fetal-maternal transfusion is very low, so you may not need to do. But for surgical terminations, other than for as a blighted ovum, then if a mother is rhesus negative, then you are supposed to give the mother anti-D in order to prevent her becoming isoimmunized, unless the spouse is also rhesus negative.
As the pregnancy progresses, would you say that the risk in terms of the complications of abortion, do they increase also?
Yes, of course, depending on the person who is conducting it, but we know that late pregnancy terminations, then the risk increases. The risk of bleeding increases. The risk of incomplete termination of that pregnancy will increase. The risk of perforating the uterus will also increase. The risk of infections will increase because you need more manipulation in a patient who has a late pregnancy than a very early pregnancy. Yes. And that is why you find even in countries that have legally allowed for termination of pregnancy or abortions, then there is also a limit in which you can safely say that this pregnancy can be terminated. Like in South Africa, I think they don't allow termination, legal termination after 14 weeks. In most of the US states, you find that have allowed legal termination of pregnancy, they don't allow termination after 20 weeks.
A very interesting conversation on abortion that we've just had alongside Professor Anthony Wanyoro. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy, and live with a healthy you segment.